Knowing how to correctly perform CPR will help you provide care to an infant having a cardiac emergency until another trained responder or EMS personnel take over.
6 and 7 and 8 and 9 and 10.
First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR. Position yourself next to the infant mannequin with your gloves on and your CPR breathing barrier ready. Place one hand on the infant's forehead to keep the airway open. With your other hand, put 2 or 3 fingers in the center of the infant's chest, just below the nipple line. If you feel the notch at the end of the infant's breastbone, move your fingers slightly toward the infant's head. To give chest compressions, position your fingers pointing straight down and push hard and fast on the chest, about 1.5 inches deep. Now, give 30 chest compressions. Try to keep an even pace. Counting out loud can help you. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12.
Each compression should be smooth. Let the chest rise completely before pressing down again. When you come up, be sure to keep your fingers on the chest. Okay, stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
Okay,
29,
stop.
30.
CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then make a complete seal over the mouth and nose. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. Your instructor will now pause the video and help you practice giving rescue breaths. Now practice doing cycles of 30 chest compressions followed by 2 rescue breaths. Get into position, place one hand on the infant's forehead to keep the airway open, and put 2 or 3 fingers of your other hand in the center of the infant's chest, just below the nipple line. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, and 4, and 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
Okay, stop. Your instructor will pause the video to give you some feedback. When we begin again, we'll put together all the pieces you've learned to simulate a real response. Now let's simulate a real response, from checking the scene to checking an unconscious infant and through a few cycles of CPR. Stand a few steps away from your mannequin with your gloves on and your CPR breathing barrier ready to go. On my cue, check the scene for safety, then check the unconscious infant. You will be given only the information necessary to make a decision about what to do next. Ready? Go. The scene is safe.
Baby, are you okay?
There is no response.
Call 911. This baby's unconscious.
1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000.
There is no breathing.
One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Do not stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator, or AED, is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue. Or the scene becomes unsafe.